Okay, good morning everyone. Okay, before we will proceed, I will ask you to sign the attendance, please. Thank you. Yes, sir. Thank you. Okay, today our training is on the AED application. So, first, we'll define what is AED. AED is an automated external defibrillator. Um, as portable life-saving device sign that treat people experiencing sudden cardiac arrest or a medical condition that causes your heart to stop beating suddenly or unexpectedly. So this is the most important thing. So why we need AED. So the steps on AED. First, I will introduce you the steps. Okay. So first, turn on the AED. Follow the audio prompt. So there is instruction. So before you place the pads, so open first the abdomen, not the abdomen, remove the shirt, pull it up, then wipe. Okay, if there is a medical patch or a medicine patch applied, so remove it, then wipe. Then after that, so attach or plug the AED, then place the AED. Yeah? So that's the connector. Then make sure that no one should touching the patient, because the patient, if the shock will be given and somebody's touching, so you have another patient. So it should be clear. So if the AED recommends to deliver the shock, so before you deliver the shock, be sure that nobody is touching the patient and you yourself. Then after that, you push deliver the shock. Then the prompt will tell you if you perform EED or you check the pulse or breathing. Then after that, so put the patient in recovery position. So that's the only steps on how to administer EED. Okay, so now I will show you a video presentation on how to use EED. Okay, just watch. Okay, you're already done. So let's go now the actual demonstration on EED application. So first, okay. So with all the equipment's already here, everything is already prepared. So the EED is in place. So based on the instruction, first step, so here the EED, bring the EED, then open the EED. So there are EEDs that when you open, it's already automatically on. But if not, so you on it. Then after that, remove the shirt, okay, open or put it up, then wipe. Here's a sponge here. So always be reminded that before doing any procedure, you must always wear your PPEs or the gloves. Then wipe the chest, remove the patch, or there is a medicine patch attached, so remove it, then wipe, then after that one, so plug in. So if the ED is not plugged, so you plug in, then administer or place the pads. So this is the pads. So once it's placed, the ED will give audio prompt, give you instruction what to do. So the ED will say clear, so clear, nobody touch the patient, then deliver the shock, push the button. So there are EEDs that there's no push button, so automatically. So once you put the EED, nobody should touch the patient. So the EED will advise if already clear, then push the button, then if completed, then the ED will advise you to perform CPR, or the patient has pulse or breathing, then put it on the recovery position. Okay, so that's it. That's very simple. Okay, now let's go to our assessment. Okay, first I think in my record I see Miss Irene. Okay, thank you. So I think Miss Irene is a nurse, and you are employed in the BFP in the ambulance, or you are assigned in ambulance for operation for 2 years. So I think you have already experienced this, and based on the record, you submitted your already certificate with this EED application, CPR and EED. So I think I recommend you for institutional assessment. Are you ready? How good. So let's go, follow me. We will go to the institutional assessment area. Okay, we're here. So before we will go on the assessment, so I want you to answer this question, okay? This is only 15 items. Then if you have items, and I will give you 20 minutes to answer that one. Okay, thank you. Very good. Can you check this first? Then I will give you the result later, okay? So, I think we will go to the practical. Are you ready to perform the practical? Okay, it's okay. You can perform. Okay, very good. So, I think you place it properly and you follow the prompt accurately, and before you clear the area before or administering the shock. So very good. So I think you're already competent, really competent. So before you go, so I have here I will give you a question, no? Before I continue. So I will give you to continue. I will give you these two questions. So the first question is, when do you administer or apply the EED? Okay, that's very good. Good answer. The second question is, where is EED should be placed? Okay, thank you very much. And I think you answered the question very well. That means you are competent enough, you perform the task and the demonstration very well. So I think you're already skillful to that. So before we'll go, we'll see first the progress chart if you already completed. So I think you finished this one also. So I think you check this one, and your achievement chart also is okay. So thank you very much, ma'am. But before you will go, so we have here in evaluation. Okay, can you answer this? I will give you time to answer that evaluation. The purpose for that is to improve our facilities and the content of the training. At the same time, the trainers can give you more. Okay, thank you. So I think you're already completed that before. Okay, before you go, I will give you this post-test. Okay, post-test. So in every pre-test, there is post-test. So can you answer that? There's only 15 items. I will give you 20 minutes to answer that one. Okay? Okay, are you done? Thank you very much. Okay, so see you tomorrow in the practical work area for our next competency. Okay, thank you very much. Then, sir, I have here Miss Mr. Olivac. Okay? You saw already the demonstration and the video presentation. Very good. And I told you last time that you will go to the practical work area to practice, right? Oh, because I know that you don't have any experience on the applications, and since you're also a student, so I think you practice there. Okay, may I see your CBLM? Okay, thank you. Oh, I think that you answered all the subjects very well. Did you read the information about the application? Okay. Oh, very good. So I think you're ready for the demonstration. Are you ready to demonstrate the EED application? Okay, very good. So will you do that? Okay, very good. So may I check? Okay, you place it properly. Then I observe that you also followed the prompt correctly. So I think you perform very well, and you did that with competence. Okay, so I think I will recommend you for the institutional assessment. Are you ready for that? Okay, very good. So can we go there? Okay, since we are here, before we will go to the institution, the assessment proper, so I would like you to answer this first. report. Ano? Test report. It's only a 15 item, so I will give you 20 minutes to answer this one. Okay, thank you. So I will check this, then I will give you the result later. Okay. So thank you. So we will go now to the demonstration. Are you ready to perform? Okay. So but before that, I have here the documents. Okay. It says this is a form. So if you have any question, can you read it properly? Then if you have question, give me ask question, because you cannot ask the question if you started the demonstration. Okay. So if you're ready, you have no more questions. So okay, you can start the demonstration. Okay, very good. So are you done? Okay, may I check? So I think it's okay, attached properly, and you did it very well, and the connection also attached. And I also observed that you followed the prompt properly. I think you're already competent in application of EED. So before that, we will continue. I will ask you questions. No? Before we will finish the assessment, so I will give you a question. First question, when do you apply EET? Okay. Very good. That's the correct answer. Okay, the next question, I think, where you place the EED? Do you think? Where? Exactly. No? So it should be placed in areas with lots of people. So I think you're competent because you answered the question very well and you completed the task smoothly. No, I performed it very well. Then I think that you did it in accordance to the competency standards. So I think and I think here. Your report, no, and your written report, you've got 90%. That's impressive, okay? So, I think you're very good in EED application. So, before you will go, we will see first your achievement chart. Okay, here, since you completed this one, we will check and we go to the progress report. The chart, then okay, you completed already, so that's very good. So before you go, I would like you to answer this evaluation. So this is to check if improve our facilities and also the content and the trainers, what we can do more. Okay, thank you. Then another. So before you go, also we have here the post test. So kindly check, answer this post test. Okay, very good. You're done. So since you completed already, you're competent in EED application. So if you have any questions or clarifications, so I will see you tomorrow at the practical work area for our next competency. Okay. So I think you're ready for tomorrow. So see you there and have a nice day.